If you're over 50 and still masturbating, there's something critical about your prostate health that you need to hear about. Hello, gentlemen. I'm Dr. Catherine Hayes, a urologist with over 30 years of experience helping seasoned men maintain their sexual health and protect their quality of life as they age. Today, we are going to be discussing something that a lot of men are ashamed about and also is surrounded by a lot of misinformation: masturbation after 50, a topic that even many doctors shy away from. The research we are going to look at today will completely change how you think about this topic. Researchers at Harvard Medical School followed nearly 32,000 men for 18 years, starting with a questionnaire from 1991, which was followed through 2010. What they found was, least to say, shocking. Men who ejaculated 21 or more times per month had a 20% lower risk of prostate cancer compared to men who only ejaculated 4 to 7 times monthly. Can you believe that? 20% lower risk of prostate cancer from something as simple as ejaculation. But that is just a small piece of a bigger puzzle. Critical and important questions like, does frequency matter? Can it affect urinary symptoms or erectile function? And are there any health benefits? Should also be looked at. Questions that men over 50 should absolutely know to protect their prostate, improve sleep, reduce stress, and even support erectile function as they age. Before we start, do me a favor and like the video, comment where you are watching from, and subscribe so that you never miss evidence-based advice designed for men over 50. I want to start by being very direct with you. Many men have questions about masturbation, but very few feel comfortable bringing it up during a medical visit. Is this still normal at my age? Am I doing it too often or not enough? Is it helping my health or could it be causing problems? I want to say this to you, you are far from alone. 63% of men over 50 masturbate regularly. Large population studies in Europe report that roughly 6 out of every 10 men between the ages of 60 and 75 have masturbated within the past month. In other words, this is a normal human behavior that continues even as you age. From a medical perspective, regular ejaculation is extremely important as it directly interacts with how the prostate functions, especially as the body changes with age. Changes like enlargement of prostate, urinary problems, and reduced sexual response. Regular ejaculation plays a protective role during these changes, and many men never hear about them. Today we're going to talk about 7 important things about masturbation every man after 50 should know. This information is backed by peer-reviewed research and is extremely crucial for your sexual health as you age. Stick around and let's begin. Number 1, prostate protection. This is honestly the best benefit, and the research behind it is very solid. Earlier, I mentioned a large study from Harvard Medical School. Researchers followed just over 31,000 men for 18 years. The results were later published in European Urology, which is one of the leading journals in urology. Men who ejaculated more had a lower chance of getting prostate cancer. The pattern showed up across age groups, but it became especially meaningful as men got older. Later, researchers from Australia also wanted to look into this topic. A separate Australian study published in BJU International found similar results. Men who averaged 4.6 to 7 ejaculations weekly were 36% less likely to be diagnosed with prostate cancer before age 70. So what's actually happening in the body? Researchers came up with several explanations. One is called the prostate stagnation hypothesis. Put simply, regular ejaculation helps clear the prostate of potentially harmful substances. Your prostate produces fluid that becomes part of semen. When that fluid sits for long periods without being released, it can contribute to congestion and inflammation inside the gland. Regular ejaculation helps keep that system moving, almost like flushing out a pipeline. It also supports healthy tissue turnover, reducing the probability of a cell turning cancerous. I had a patient in his late 50s with a strong family history of prostate cancer. Naturally, he was worried. After we talked through the research, he made a conscious effort to maintain regular sexual activity. Over the following years, his PSA levels stayed stable, and his exams remained reassuring. Although this is not a cure to cancer, it is one meaningful factor that's within your control. Comment down how many times you ejaculate weekly. Number 2, the mental health side of this, which honestly doesn't get talked about enough. When you ejaculate, your body releases a mix of neurochemicals. Dopamine is released, which supports pleasure and motivation. Oxytocin helps your body relax. Serotonin stabilizes mood. Endorphins act like natural pain relievers. There's also prolactin, which rises after orgasm. It plays a role in relaxation and has been linked to protective effects against stress-related strain on the body. For many men in their later years, retirement adjustments, health concerns, sleep problems, relationship shifts all cause a lot of pressure. Regular sexual release can act as a natural stress regulator without medication and without side effects. Sleep is another big one. The body's relaxation response after ejaculation helps shift your nervous system into a rest state. Many men notice they fall asleep faster and sleep more deeply. I had a patient in his early 60s who struggled with anxiety and chronic insomnia. He wanted to avoid prescription sleep aids if possible. We talked about incorporating sexual release into his nighttime routine as a way to signal the body to wind down. Within a few weeks, he reported more consistent sleep and noticeably lower anxiety. This shows that your mind benefits too. Number 3, the optimal frequency. This is where most men feel unsure. A very common question is, what's normal? And more importantly, what's actually healthy? When researchers looked at long-term prostate outcomes, they noticed a pattern. The strongest protective association showed up in men who averaged around 21 ejaculations per month. That's roughly 5 times a week. Some weeks may be more, some less. What matters is the overall pattern over time. This includes everything, whether through partnered sex, solo masturbation, and even nocturnal emissions. For men in their later years, especially those who don't have consistent partnered intimacy, this becomes less about sexuality and more about maintenance. Think of it the same way you'd think about exercise or sleep. It's part of how the body keeps certain systems functioning well. Interestingly, research shows masturbation rates are very similar between men who have partners and those who are single. So this isn't about replacing intimacy with a partner. It's about maintaining prostate health regardless of relationship status. Another important point, more is not automatically better. The protective association levels off around 21 times monthly. Going far beyond it doesn't appear to add extra benefit, and in some cases can lead to irritation or fatigue of the tissues. I remember a patient who felt genuine guilt about masturbating several times a week, even though he had a strong, healthy marriage. Once he understood the research, his mindset shifted. He stopped viewing it as something shameful and started seeing it as a normal part of maintaining his health. And honestly, that shift alone reduced a lot of unnecessary stress for him. As we continue, the next point is important because how you approach this matters just as much as how often. Number 4, the mistakes that quietly cause problems. This is something I wish more men understood. Approaching masturbation after 50 is a little bit different than when you were younger. Let's go through the most common issues I see in real patients. First, not using lubrication. As men get older, the skin becomes thinner and less resilient. Dry friction can create tiny micro-injuries. Over time, those small injuries can lead to irritation, scarring, and reduced sensitivity. Use water-based or silicone lubricant to reduce friction and protect the tissue. Second, gripping too firmly. Some men notice reduced sensitivity with age and respond by increasing pressure. Unfortunately, that creates a cycle. More pressure leads to more irritation, which leads to even less sensitivity, which leads to even more pressure. A lighter touch with more patience is actually healthier and more effective over time. Third, excessive overstimulation from constant high-intensity pornography. Occasional viewing is normal, but when stimulation becomes very intense or frequent, some men start to notice their arousal response reduces with overly stimulating content. This is about how the brain adapts to repeated stimulation. When that happens, real-world intimacy can feel less responsive. Moderation helps preserve natural sensitivity. Fourth, ignoring warning signs. Pain before or after masturbation, burning during urination, blood and semen, and difficulty ejaculating are not things to push through. Those symptoms can signal inflammation, infection, or prostate irritation. That's your body asking for attention. And finally, rushing through the process. After 50, the body simply works at a different pace. When everything is hurried, ejaculation can be incomplete and less comfortable. Slowing down allows normal muscular contraction and proper emptying of the prostate fluid. I remember a patient in his early 60s who came in with pelvic discomfort that had been bothering him for months. His symptoms included sexual discomfort and bowel changes. I found that his routine involved very aggressive technique. Once he adjusted those habits, his symptoms gradually resolved. Frequency matters, but technique matters just as much. And the next point is where many men become unnecessarily worried. Number 5, something that doesn't get talked about enough: guilt and shame. I see this especially in men who grew up in very traditional or religious environments. Many were taught, directly or indirectly, that this behavior is something to feel embarrassed about, or something that reflects poorly on them as a person. So they carry that tension quietly for years. From a purely medical standpoint, I want to be very clear with you. In healthy, reasonable practice, masturbation is considered a normal human behavior, and in fact, as we have discussed, healthy. In men over 50, it's also associated with measurable physical and psychological benefits. There is no scientific evidence showing harm when it's done in a balanced way. But health is also emotional too. If someone experiences internal conflict because of personal beliefs, that deserves respect. In those situations, talking with a counselor, therapist, or trusted spiritual advisor can help reconcile those feelings in a way that aligns with personal values and well-being. I once spoke with a man in his late 60s who told me something that stuck with me. He said he had spent most of his adult life feeling quiet shame about something that turned out to be completely normal. Learning the medical facts didn't change his beliefs, but it helped him replace fear with understanding, and that alone improved his sense of peace. Number 6, supporting erectile function. Regular erections are not just about sexual activity. They're part of how the tissue stays healthy. You can think of erections as a kind of circulation exercise. When blood flows into the penile tissue regularly, it helps maintain elasticity in the blood vessels, keeps the tissue oxygenated, and preserves the responsiveness of the erectile mechanism. Without that regular blood flow, the tissue can gradually lose some of its flexibility and strength over time. Regular sexual activity, whether with a partner or on your own, helps maintain those normal physiological pathways. It keeps circulation active and supports the systems that make erections possible. I remember a patient whose partner had serious health challenges, and intimacy wasn't possible for over a year. Out of care and respect, he avoided any sexual activity altogether. When life eventually stabilized, he was surprised to find he wasn't getting any erections when engaging in sexual activity. We focused on gradually restoring regular blood flow and stimulation through masturbation. After 6 months, he noticed steady improvement because the body responded once circulation and function were reactivated. The takeaway here is simple. Maintaining function often requires maintaining use. Number 7, when it's time to get professional help. For most men, masturbation is completely normal and healthy. But there are a few situations where it's important to talk to a doctor or a mental health professional. First, if it starts interfering with your daily life. If it's affecting your work, your focus, your relationships, or your responsibilities, that's something that deserves attention and support. Second, If you feel like you've lost control over it, if you want to stop or cut back but feel unable to, that can be a sign of compulsive behavior. That's something that can be treated with the right help. Third, if you notice persistent physical symptoms, ongoing pain, bleeding, significant skin irritation, or difficulty ejaculating are not things to ignore. Those are medical signals, and they should be evaluated properly. And fourth, if it's completely replacing intimacy with your partner. If masturbation becomes the only form of sexual expression because it feels easier or less stressful, that can create distance in a relationship. In that situation, support from a counselor or therapist can be very helpful. Most men will never run into any of these issues. But if you do, there's nothing embarrassing about getting help. Addressing concerns early almost always leads to better outcomes and a lot more peace of mind. For you to put everything into action starting tonight, let me give you a practical framework to put it all together. For frequency, aim for about 20 to 21 ejaculations each month, roughly 5 times a week. This can include both sex with a partner or solo activity. It's the total count that matters for prostate protection. For technique, always use proper lubrication, water-based or silicone-based. This protects delicate tissue from friction damage. For pace, don't rush. Taking your time allows for complete, unhurried ejaculation, which gives the maximum health benefits. For balance, if you're in a relationship, try to maintain a mix of partnered sex and masturbation. Both have unique benefits for your health and your relationship. For pornography, if you choose to use it, do so mindfully and in moderation. Habitual or excessive use can lead to dependency or altered arousal patterns. If there is any pain, discomfort, or noticeable changes in function, prompt a medical checkup. For mindset, let go of guilt or shame. This is not indulgence. It's scientifically backed health maintenance. I had one couple who were struggling because the husband masturbated a few times each week, and the wife felt rejected. After openly discussing the health benefits and framing masturbation as complementary rather than a replacement for intimacy, their relationship improved significantly. Clear communication and understanding resolved tension that had been building for years. Following this framework helps you optimize the health benefits while minimizing potential risks for both your prostate and your relationship. That will be it, gentlemen. Masturbation is totally normal and healthy. Stop letting misinformation guide how you handle your health. Remember, you have the power to significantly change your prostate health through regular ejaculation. Use that knowledge. If you found this information helpful, go ahead and hit that like button right now. Drop a comment below. What surprised you most about this research? Did it change the way you think about your sexual health? And make sure to subscribe for more evidence-based guidance on topics that many doctors won't talk about openly. I'm Dr. Catherine Hayes, and I want you to know that your sexual health matters at every age. Take care of your prostate, take care of your overall health, and live with confidence, knowing you're making choices that truly benefit your body.